Welcome back to the Gallo Show on a Friday morning. Dave Hughes here. And we are joined now by District 14 Representative. There in the studio with us, Representative Sam Creekmore, the chair of the House Public Health and Human Services Committee. Representative Chairman, how you doing this morning?
I'm doing well, Dave. It was a little cool this morning in Jackson when I got up.
It's a bit nippy, yeah, just a little bit. Before we get into anything else, I got to brag on something. I got to make sure everybody is aware of this because this is a passionate topic to me, too. When was it? Was it yesterday? I know that's when you posted about it. I think it was day before yesterday, probably, that you received the Mental Health America 2024 Legislative Champion Award. Don't smile at me like that. I'm telling on you. Chairman, congratulations, well deserved.
Well, thank you. And I tell you, Dave, it's as you know, when you're passing legislation, you're just the author. You rely on so many people, and in this mental health space that we're in, you know, I've relied on so many people across the state and so many experts, and they're so passionate, and it's personal. And so I accepted the award, but you know, it's not an endpoint. It's just a place where we can keep going and really invigorates me to keep doing work in this space. But I accept it on behalf of so many people that have helped.
Well, and I have to say, and I think you make a great point there, with a lot of awards, whether it be championships, we've got state football championships going on right now, whether it be in the entertainment industry, whatever, an award is for work that you have done. This kind of award is for the work that you're doing, I think.
And I agree. And as you know, in the mental health space, there's a stigma that kind of goes along with that, and just to have some recognition and shine a light on some of these issues, and if this helps doing that, then I'm very proud to accept it and look forward to continuing work in this space.
Well, would you say that is probably the biggest challenge with dealing with mental health and the problems that we have, getting things where they need to be with mental health support in Mississippi, the fact that there is a stigma about it?
Absolutely. I think it's one of the biggest obstacles we have to overcome, and just having this conversation that we're having today helps remove that stigma. You know, the mental health well-being of people in our state and beyond is so important, and it doesn't just apply to the sick and the needy or the underprivileged. It applies to everybody, and it's not a Democrat or Republican issue. It's a human issue, and you know, I think we all need to be evaluated at different times in our life.
Well, I will say this, and you will not find a mental health professional that will disagree with this. Wherever you're at, wherever you live, what part of the state, what part of the country, what part of the planet, it doesn't matter. You know someone that is having mental health struggles and problems right now, and you're not aware of it because they're really good at masking it, at hiding it.
As we all are. We all want to be independent and think we can handle anything, but the truth is we can't. And sometimes when you just keep putting it off, you get to a space where, you know, I just can't go on. I need some help. And if we can catch that earlier, it's so much better. And, you know, we've had some hearings this past summer about mental health with youth and in schools, and that's really shown up where there is a need in Mississippi.
Well, there definitely is, and it's great that we've got somebody like you that's fighting for this, because a lot of people don't even want to touch this topic. They don't want to bring it up.
They don't, but we're getting better, and things have improved in the state of Mississippi, and we're having less people in jail for mental health issues. They're getting treated quicker, and so things are getting better.
But we're not where we need to be. It's going to be a long time before we get there, I think.
And, will we ever get there? I don't know, but we're going to keep fighting the fight.
All you can do is keep driving. Sooner or later, you're going to make it to your destination.
That's right.
Sorry, I know this was nothing to do with what we were supposed to talk about this morning, but I also didn't care because I am very passionate about this topic, and you're doing good work, and you deserved a recognition.
I don't know about the deserve, but I'm proud to accept it on behalf of so many people who've helped me throughout this state.
Now, let's talk about the year. You talked about some hearings with mental health that happened over the summer. We had one whale of a legislative session back at the beginning of this year. That's a nice way to put it, don't you think?
That seems like 2 years ago. But yes, with the changing of the guards and the speaker, we missed Philip Gunn, but Jason White has done an outstanding job, and he hit the ground running. His first speech, he said, "We're going to chase every lion down the hole," and so we've been chasing lions and tackling large issues throughout the state.
Now, one thing that I think your comment about the hearings underscores that sometimes people forget, just because the legislative session is over doesn't mean you stop working. It goes on all year, doesn't it?
It does. And as being chair of public health, I have a lot of responsibility to be in Jackson, more than I ever anticipated. But I'm happy to accept it. I'm down here 10 days a week a month out of session, so that's a lot of time.
Now, let me ask you this. With the work that you've been putting in since the session ended, a lot of that aimed towards the coming session, and I cannot believe I'm going to say this. I know you can believe it even less. Coming up in just a few weeks, we're almost there. What should we be looking towards for this upcoming legislative session? What's the big things that stand out that you would like to see have happen?
Well, and mainly I can talk about it in the public health area, but again, I don't think Speaker White's backing down, and the House is not. Medicaid expansion is going to be a topic for sure. We're looking at CON reform, certificate of need, and that's hadn't really ever been touched or hadn't been able to get through to the finish line since Republicans have been in power. So that's going to be a priority. Again, of course, the mental health. I'm going to be looking at mental health with our youth in our school systems, the K through 12, mental health job retention. We had a hearing yesterday, and every one of them pointed to we even if we had the money to pay the workers aren't out there. So we're going to have a job retention bill. Transportation, especially as you know, Dave, our mental health across the state's broken down into regions, and some regions are very large geographically, and so we're looking at a pilot program to pass so that we can take care of some of these rural areas. Maybe 3 regions would be in the pilot program, and then I think this is an important issue. We define rural in our state, and I think it's really based on a national rural definition, which really does not apply to Mississippi. I'm from New Albany. That's considered a rural area, and by national standards it is. By Mississippi standards, it's really not. So I'm looking at redefining that term rural, where because we got incentive programs in public health where we send doctors to rural areas, but we're sending them to places like New Albany when they can really need to be in the critical areas, such as in the Delta. So that's one of my priorities is to look at that definition and maybe redefine it.
That's a really good idea, actually, because it does change the perspective in how you look at these things. Because, like you say, if you compare us to, California or New York, by the way, don't ever do that. But if you did, yes, the entire state's rural.
That's right.
The whole thing is.
That's right. But we need to look at the critical areas of the healthcare deserts, and those are areas that would fall under this redefined definition, and send the doctors who are getting these incentives to go there to the most critical areas. Nurses, doctors, teachers.
Yeah, you got to fill in the gaps where they exist, because even in this state, in every state, there are areas where it's just, when it comes to healthcare, a wasteland.
That's right. And, I think the education people get it right. They send the teachers to the critical needs areas. And I think we can redefine that in healthcare and get more professionals to those critical need areas.
Is that going to be an uphill battle?
I don't think so. You never know in the legislature. You think the most easy thing that's going to pass all of a sudden blows up in your face, and some of the most critical things can just fly through. I just don't see it being an uphill battle. Everybody knows the need, and of course it's been talked about on SuperTalk and the news about our health care and how far behind we are. And how unhealthy Mississippians are. So, how do you argue with getting professional healthcare people into the most needy places?
We can have an argument on how wet water is. You know that's part of the process.
That's right.
You have to sit through those arguments. I'm not telling you any news here. There's no breaking news involved in this. We have Representative Sam Creekmore with us. Can you stick around through the break?
Love to.
Lance, get this man a cinnamon roll or something. Let's be welcoming. He earned it. He got an award, for crying out loud. We got to recognize that. We will continue with Representative Creekmore right after this on the Gallo Show. Keep it here. Perfect. Lance coming through with the Christmas cake.
Hey, man,
there you go.
I try to deliver when the host asks.
Very well done. That
Lance
is perfect. It's well earned.
They're going fast around here too. They're going fast. Get your Christmas cakes while they last.
Well, I can guarantee you one thing: you didn't leave him short. If I know Lance, he's got like a crate of those things.
I've got more hidden. You got that right.
A couple of things I want to get to quickly. Number one, tying back to what we were just talking about in the last segment about mental health. You've got an interesting take on a bill you want to bring up in this next session that we're talking about that I think ties into mental health in a big way involving cell phones.
Oh, well, it really does. And again, going back to the K through 12 mental health hearings we had this summer, it became very evident that cell phones not only are just disruptive in our classrooms and our schools, but they also affect the mental health of our children. And if you look over the past 10 years since the iPhone's been invented, how self-harm has gone up, suicide obviously has gone up tremendously and doubled, and it's really had an effect not just on boys but on girls tremendously. And it attributes, a lot of it attributes back to cell phones, social media, cyberbullying, and so I've got the framework of a bill that would ban the cell phones in our school systems. What that 100% looks like has not been decided yet, whether we just mandate it from the state or just send it down to the school boards to make that decision on how that's going to work. But to me, it's very evident that it's a real problem, and it really rewires the brain. A child's brain's not fully developed till around 25, 27, and these are critical years in their maturity while they're in elementary through high school. My wife, she's not a teacher, but she was teaching a class in Tupelo to a group of third graders. And the first thing she asked them was, how many of y'all have cell phones? Every one of them, third grade, raised their hand. So they're growing up in a instead of a play-based childhood, they're growing up in a phone-based childhood. And if we can take that out of their hands just for that 7-8 hours from bell to bell, I think it would make a huge difference socially and mentally in these children's development.
Well, I have to say I totally agree with this, and it goes back to something Lance and I were talking about earlier this hour, that we are inundated, all of us, with a nonstop deluge of information, and if you get overstimulated to a ridiculous extent, you will start to lose your mental faculties. It's even worse for a child, I would think.
Yeah, and sometimes as an adult, you have the phone and it vibrates, and you're in a meeting, and all of a sudden you get these anxiety feelings. Well, something's going on that I need to address, although you need to stay focused on your task at hand at the moment. The children have that same feeling and don't handle it as well as an adult does sometimes, and it's really making a difference. And we're not the first state to look at this, and in fact, several other states are doing some form of this. Even Australia, the whole country is banning it for their children in schools. So. But it's something we really need to take a look at, and I think it's extremely important.
Well, I would agree with you 100%, and I'm certainly hoping you get something done on this, even though I know it's going to be a difficult conversation.
That's a difficult conversation. And another thing is just a mental health checkup for our children, while they're in schools. We do check their eyes, We check their ears, but what about the other part above the neck, the brain, and that came out of this task force too. That's again, it comes down to a staffing issue and money issue, but it's extremely important. So those are two other items that we're looking at in the education realm and mental health, public health, well-being realm.
Very good. And before we go, Bruce, Mississippi lost a big one yesterday, didn't they?
They did. Representative Andy Stepp, who was a freshman and 66 years old, one of the kindest men I know in the legislature, and you in the legislature. And he was on the Public Health Committee and was very valuable to me. He was a pharmacist and just was always willing and able to do whatever you asked. Showed up for every event. He loved Mississippi. He loved his hometown of Bruce, and he is deeply missed.
And he will be moving forward. I assume now there will have to be a special election to fill that slot.
Yeah, I was asking somebody last night, and the governor I think has 30 days to call that. I'm not sure how that process works, but it's going to be a different session going in without him.
Representative Sam Creekmore, chairman of the House Public Health and Human Services Committee, and he now has an award certificate and a Christmas cake. So there.
Yeah.
You need to listen to this man, definitely. Thank you so much. Keep us updated as we get into the session, how all of this is going.
Dave, it's always a pleasure to talk to you. Thank you for having me.
If I need to call and scream at somebody about mental health, let me know.
You call me.
I can talk real loud.